Hi, everyone. My name is Christy Hubbard, and I am a professional counselor that's licensed outside of Columbus, Georgia. And I am talking today about information regarding panic and anxiety attacks. I appreciate PSI Georgia having me on this evening to discuss this topic. And thanks for letting me join. And feel free to submit any questions below as we go along. And I will wait until the end, of course, to answer any of your questions. But this is definitely my first time I've ever done a Facebook Live episode. So I'm excited to share with you about exactly what is a panic attack. A panic attack or anxiety attack is explained best by an episode of intense fear. It is a discomfort, and it can be both physical and emotional. There are many symptoms of a panic attack that a mom might be experiencing, because the purpose of this video too is just to let moms and parents know the signs and symptoms in the treatment, and that really that they're not alone, that many people experience anxiety. As a person that has experienced anxiety many times in my life, I hope that this will be an outreach too that shows that you can live with less anxiety. But some of the symptoms are heart racing, feelings of weak and faint and dizzy feelings. Sometimes you can have tingling in your arms and even your legs, and numbness. Another symptom is intense terror, feeling sweaty and having chills. Chest pains can also be something that is a symptom. A couple of other symptoms would be breathing difficulties, feeling a loss of control. Also a disconnection almost of reality, maybe feeling disconnected from your body. I hear that often from clients that come into my office. We talk about this subject very much. Really, as of lately, I've seen most women that come in, they're having some type of anxiety or panic attack. And they're sharing with me the physical symptoms, the questions that they might have. And honestly, I do want to kind of break it down that this phase of life is, it's very common to have anxiety about different things, because you're experiencing many life transitions between, you're pregnant now, or maybe you've had your first baby, or maybe you've had your second, or multiple children. Having a new baby can cause these symptoms to really intensify, because I want women to realize that they do have hormonal issues that are happening, as well as people are experiencing lack of sleep. If you're pregnant, maybe uncomfortable sleep. But I kind of want to move into triggers. This is important to me because I feel like identifying your triggers if you're experiencing anxiety is important. So I always tell people to track their symptoms and journal them, or send them to me in what I call a portal. I call it portal journaling, but it is a great tool, and it allows you to identify your triggers. So for example, what is a trigger? I would explain that as something that you have noticed throughout your day that might cause intense fear or worry. And these things can be several things, like location. For example, I recently had someone tell me that it was difficult for them to go to the doctor's office, which I hear very often, or even the thought of going in and having their baby was causing them some symptoms of panic, as well as outside symptoms, like if you maybe watched a commercial that made you feel a certain way. Oftentimes I've seen this too, as you have a baby and you're going into this phase of life, that all your childhood experiences sometimes come up. So many times memories may be something that can be a trigger for a person. But there is hope out there for any of this. And there are prevention tools, which we'll go in to further in a little bit. But memories, location, and stressful events, I think, are very important to kind of take note of. But prevention, I'm going to look at my notes a little bit here so I don't miss anything, but prevention is key in knowing the signs. So I do want to go specifically over how do you know the signs. And I know we talked about symptoms, but you know the signs when something is, it becomes not just that little worry or anxiety. You have noticed that maybe you have been staying up at night and you're having intrusive thoughts, and it becomes really intense. So what I mean by intense is that it becomes, you have those physical as well as emotional symptoms. So coping skills, I'm going to go through like 6 different coping skills today and hopefully kind of give you a tool on how to manage your anxiety or your panic attacks that you might be having so you can better understand that. Or also this is for someone that may have a loved one that's experiencing anxiety. But managing your panic attacks is one thing I love to tell people is challenge your thoughts. Sometimes some of my clients might be watching and they're like, okay, here she goes again. Challenge your thoughts. I look at even my personal thoughts, and I notice that sometimes I can think about things in worst case scenario. I hear something or I'm having a feeling and all of a sudden it is the worst possible thing that could happen. So many times, for example, I will challenge that thought. And I want to speak from a personal view of that and say, is that thought real? Like, what are the chances of this actually happening, et cetera, et cetera? Or I'll try to minimize my thoughts, saying that it's not really that important. I'm saying all this because I want people to like realize when they're listening that your thoughts are so powerful and your feelings come so fast that sometimes everything's happening all at once, which is where the overwhelming feeling is coming from. So having that support system, even to help you manage, to challenge those thoughts. Also, like I said before, tracking your panic attacks. So a good question is, how do I do that? How do I track a panic attack? I have a tool that I'll post later, but it's basically asking yourself several questions like, what was happening that day? What time of day was it that I experienced both the physical and the emotional symptoms of where it was difficult to calm down, it was hard to breathe? What worries or fears did I have? If you've recently had a baby, it could be something like you were afraid about maybe if the baby was going to wake up and when the next bottle was going to be. Or it could even be you're afraid to bathe the baby. And many times some of these thoughts can happen a lot when you're alone. But tracking your panic attacks, I use a simple scale because I just think that if you can rate things and you can see where they're coming from, that you can figure out patterns. So I use a scale from 0 to 10. And I ask myself and also my clients to rate those. Was this panic attack the same as you had last time, or was it a level 8, or was this a panic attack that didn't last as long? So maybe you gave it a 5. So that's just an example of one of the ways that you can manage. Also confronting your feared situation. I think recognizing where the root of your situation is and confronting it and looking at it as you talk with another person, either that is in individual therapy or a loved one or a friend or somebody that you can trust, because it's very important in these things to know that safety is key. So where do you feel safe? Of course, educate yourself, just like you're doing now. Educate yourself so that you understand that you are normal and that you're not saying things to yourself that are real negative. Many times I hear women say, I feel crazy. I feel like I'm not going to ever get better. So different things that you may say to yourself that could be causing you to feel less than. I think it's important to educate yourself so you realize, hey, wait just a minute. There are so many women out there and individuals in general that suffer from anxiety that sometimes becomes too overwhelming. And of course, using relaxation skills. This is really important as well, because you can practice relaxation skills and you can get better at those. So we're going to take, in this next couple of minutes, just 3 different relaxation techniques and kind of go through them. The first one is pretty simple, and they're all kind of different. So deep breathing, and I know many of you have heard about deep breathing, but breathing in the right way is important. And this relaxation skill is good to practice before your anxiety actually gets to a point that you might be having a panic attack. But the good part about it is it actually works really well if you're in the midst of having an episode. So you want to remember to breathe in deeply and use your diaphragm. And then you want to breathe out for many, many seconds. So sometimes people say they'll do a kind of a breathe in for 5 seconds, breathe out, or they might just find a comfortable place for them, because it's important not to even be insecure in your breathing in the way that you do it. So whatever feels comfortable and calms you down is the best way to do that. And also just practicing with a professional or practicing through this is important. Another relaxation skill that I love to do is guided imagery. So even if you want to just sit back for a minute and kind of do this as I talk, but if you close your eyes and you think of a place that may be a safe place, and you visualize an object or someone special that represents strength to you, if you can identify that place in particular, that it can become more of an automatic place, this can really help you calm down and feel safe at the same time. Another one that is very helpful is progressive muscle movement. I don't know if you've heard about that, but I can do a quick explanation, which is basically it's tensing your muscles. So you're going through different parts of your body, and you're going to use tension to help relieve stress. So in turn, it causes relaxation. And again, if you have questions about that, I can do a simple post to kind of give you resources about progressive muscle movement as well. But those are just some top 3 relaxation tips that I wanted to give you. And then we'll move into the treatment options, because it's important to know with the signs and symptoms that there is hope and that you can feel better and you can live with less anxiety. So some treatment options that are available are individual therapy, and cognitive behavioral therapy is just an approach that helps, basically, I just say, retrain your brain. It's a time where you can do exercises and you can do things, like I said earlier, like challenge your thoughts and do different things to journal your thoughts. But having that accountability in individual therapy can be very helpful, because you can use that time as intentional, and you can practice these relaxation techniques. The other thing is medication management. I always think of medication as a tool that helps us live with less anxiety. So this is very, very possible. Don't be afraid to consult with your doctor and explain the feelings that you might be having. Another treatment option is, of course, writing down your feared experience, whether it be your birth story or whether it be just something that happened that is starting to cause certain fears to come up. So whatever specifically is causing the fear after you've done the confrontation, maybe writing it down and going through that. And also exposure therapy is also a good technique. And that basically exposes you to the fear. And again, if you have more questions about the specific types of therapy, please post them below, and I'll be glad to try to answer those for you. Before we get done tonight, I do want to discuss, okay, how can my loved one help me if I'm having a panic attack? or an anxiety attack, whichever way you want to express it. If you prefer to say anxiety attack or you prefer to say panic attack, either way. But things that that I've noticed that they shouldn't say, I'll start with that first. Sometimes, people have the urge to say, calm down, or just relax, or it's all going to work out. And there are people with bigger problems, they may say. These different things, or they might just want to leave them alone, and you need some alone time. I'm going to walk away. So these comments sometimes can make your loved one feel like that they're not important, in the way of, not that that's necessarily your intent, but because it's more of a problem solving, you're trying to fix the problem. And really, in the midst of a panic attack, you don't really want to be fixed in that moment. You just want to be supported and loved, and say things like, you can do this, I'm here for you. You can have a kind of a pact even before you go into that. And if you like to be touched, or you like your arm to be rubbed or your back to be rubbed, and come up with different phrases that actually do help you, that could be connected to maybe your safe place or things that provide comfort. I think that even with those simple comments of communication and trying to communicate with your partner or your support person or whoever is there with you during this time can really make a big difference in the way that you begin to reduce the amount of panic attacks that you have. Again, I often do say that there's no magical cure. I think that you can do everything that you can do, but many times in life, in stressful situations, you are going to feel overwhelmed and scared, and your body tells a story. And it basically tells us a story that we might not even remember. And sometimes our anxiety is telling us that we need to slow down, and we need to breathe, and we need to rest. So I think those are some important things to remember. And of course, symptoms and risk factors. I do have that question often, like, what makes this happen to me? And I think when it comes to risk factors, you do look at maybe previous anxiety that you've lived with. If you've ever had panic attacks before you got pregnant, or during pregnancy, you might have an increased chance of maybe experiencing that. Risk factors do include trauma. So any type of stressful event that has happened in your life that you weren't expecting can kind of manifest in these high, intense emotional and physical reactions. So I hope that tonight has been helpful. And I would love to post some resources and things that will help you and guide you and lead you in your journey of maybe reducing your anxiety. Thank you so much for watching today. I hope that you enjoyed this video. And I really, this is episode 19, and episode 20 will be hosted October 9th, and it will be on pregnancy and infant loss. So because of PSI Georgia just bringing professionals together and creating these live broadcasts, there's going to be more information for you in the form of these videos. And we just appreciate you tuning in. And we hope that you have a good evening. And I want you to remember, too, these words, that you are not alone in this fight of anxiety. You're not to blame. And in hope you will be well. So please reach out if you need us. We're a resource for you, PSI Georgia chapter. And again, I hope you have a great evening. And I will be answering questions. I don't know if I see any at this moment, but I will stay tuned and try to answer any questions that any of you may have. Thank you.